Hi, this is Ian Wright, and I thought I would just do a quick podcast on feeding difficulties in children, partly because I'm kind of just looking over a lecture I'm prepping for some pediatric osteopaths in Italy on the subject, and it's an important subject, and there are a variety of causes, and I think it's important to kind of try and decipher when a baby has a feeding difficulty. There are a variety of causes, and those causes can come from the mother or they can come from the baby, and often it's both. And there are certain things that can compromise feeding, and especially if you're trying to breastfeed at the very beginning. And for example, if mum's had pethidine or some kind of other medication, actually what it does is it doesn't help with, it suppresses the respiratory centers in the child for a while, so it makes it much harder to coordinate this suck, swallow, breathe. So if a baby's had stress or a traumatic birth, the nervous system is often in a little bit of shock, and so it's slightly slow to pick up. And these natural reflexes, suckling reflex, crawling, rooting reflexes, which are part of a natural process of breastfeeding, haven't kicked into gear, and that's why it can be very difficult to feed at the beginning. So the first thing I think to say is the best position to stimulate these reflexes in a breastfeeding mother is skin-to-skin contact, which is very, very important, and mum lying on her back and baby lying prone on their tummy. This stimulates these natural reflexes. So actually the baby does a reflex, almost a crawl, and it roots towards the nipple and heads towards the suckling, and they're all preconscious reflexes which are very strong in the baby, and that position is obviously very much best. There are other issues that need to be resolved in terms of flow. If mother's had a traumatic difficulty, it's very difficult to get flow, and the breasts need to be warmed, and the mother needs to be relaxed, and the whole situation needs to be calm. If the flow is too fast, or if the flow is too slow, it can be overwhelming, especially for a newborn baby. But in the first 3-4 days, the colostrum is terribly important, especially with regards to immune support of the newborn baby. I mean, this is a huge subject, and I'm just about to lecture sort of probably 2 hours on it. But just simple things that we as osteopaths need to look at, and that is baby needs basically coordination, neck movement. The upper neck needs to be free. Often if the neck's squashed, the upper neck can be squashed, locked up. There can be mild torticollis, lack of freedom, so baby can't feed one side and the other, and then you can adapt the feeding position to feed in the kind of full sway to adapt to that. But we as osteopaths need to free up any problems that happen in the birth process with the upper neck. The tongue function, the tongue undergoes a complex series of functions where it compresses, sucks, and there's this kind of reflex wave that comes across the tongue and allows the milk to be drawn towards the nipple from the breast, which is properly latched on. Tongue function is governed by a particular nerve which can get congested in between the head and the neck, the very top and the back of the skull, in basically the molding. But what happens is the bones of a baby, of a newborn skull, are not fully bone. Some of them are cartilage and softer material, and the bones, as we know, they pass over each other, and they can be some sort of molding, shaping patterns, and sometimes these can compromise nerve supplies, and one of them is the nerve supply to the tongue, the 12th cranial nerve. And other ones that are very important are the 10th cranial nerve, the 11th in terms of neck function, and the 9th in terms of palate function. So all of these can have an effect on suckling, swallowing, breathing coordination, which is absolutely key. So we have to, as an osteopath, we have to evaluate the function of the tongue, the function of the palate, the mechanics of the palate. The palate mechanics can be locked down. the palate can be overly sensitized with an overly reactive gag reflex. I mean, this is an important reflex, and it's there for the first 6 to 7 months. And it's there to stop too much food going down and being aspirated. But it's often in a child who's had shock or any kind of trauma in their delivery, it can be aggravated. So actually it can be forwards in the mouth, it can be on the hard palate where it shouldn't be, and anteriorly on the tongue, and that's made worse with tongue tie. Tongue tie itself obviously causes an awful lot of difficulties, but I'll talk about that another time. That's a big subject in itself. Funny enough, there are connections with the shoulder through some of the fascia through the front of the neck into the root of the tongue that attaches onto a bone called the hyoid in the throat. And so if there's a shoulder dystocia or the shoulders get caught, it can drag and affect tongue function. So there's all these kind of wider aspects that need to be evaluated. The function, you need the jaw, the mandible, to be free and working properly. The mandible can often get locked up in birth. Obviously, the jaw bone, the mandible, is much, much smaller in a newborn than an adult. They're designed small so that the head is smaller and can get through the pelvis. But it's actually, I suppose, the mandible can also be small because it can have an effect to enclose the tongue around the breast in breastfeeding. But often the mandible is locked, and if the jaw isn't functioning properly, you can't have it. Affects, number one, tongue function, but also you can't get a good latch. So we need palate function, we need hard palate function, we need soft palate function, we need tongue function, we need jaw function, we need all of those nerves which supply it to be intact and functioning and coordinated, because it's a very complex sequence of coordinated events to feed normally. So deciphering and unraveling some of those patterns is what hopefully we become good at here, so baby can root, suckle, swallow, and coordinate all of that effectively. So that's a little introduction to the kind of conundrums we face when we're trying to decipher why is this child having difficulty feeding. There's an awful lot of other ones though as well. So feeding difficulties can be caused by reflux, silent reflux, and that's a different character of the problem. We have to evaluate that. Or a colic, wind problems, obviously taking in air, which is part of a difficulty in maintaining the seal and the way that the palate locks up and protects the trachea in the swallow process. So you've got this whole process of coordinated events that need to be checked and evaluated thoroughly to see if there's any problems causing any difficulties with that. So that's a little bit of an introduction. Can talk about that for a lot. But again, babies can't talk. They can't tell you what's wrong. So we have to be quite good at working out how to do it. Also, we can adapt the breastfeeding positions. In different positions, the baby is happier and better. For example, if the baby can use a straddle position, or you can cup in a dancer hand position, so you can put your hand if the jaw is not able to close properly around the nipple, or we can hold the baby's neck at the back of the neck between the thumb and forefinger, which is quite important because the baby latches much better if the neck is supported. The baby has to feel supported very strongly in order to allow those reflex actions to happen. It's much easier when they're lying face down because there's a natural support in the system. Babies are more prone to flexing, bending forwards. They're more comfortable. They were embryos in that way. If they're backwards in a kind of lying out supine, they tend to be less comfortable and they can do a startle reflex. So actually, by supporting the top and back of the neck into this flexion, it helps with a natural feeding position. So there's an awful lot of different elements here. Okay, anyway, well, I'll get back to this subject because it's quite an interesting one. And these problems and difficulties feeding, they affect breastfeeding more clearly, but actually, even with bottle feeding, you can have all of these issues. And again, it's unraveling what the cause of those problems is, because feeding is so important to at that time. And a traumatic feed is very stressful, and very stressful for the mother. It puts a lot of tension into the whole dynamic, which actually should be an absolute pleasure if it's breastfeeding or bottle feeding. It should be a beautiful thing, eye-to-eye contact, lots of oxytocin release, bonding in a very deep way. It's a wonderful experience as a mother to feed, or as a father when you're feeding with a bottle. It's a beautiful experience of bonding and connection, and to actually decide to unravel some of these feeding difficulties, as they present themselves, is helpful, and I think in a lot wider a way. Anyway, I wish you well.